Hi, my name is Daisy Sosa and I'm your dental hygiene student. Today I would like to talk with you few minutes to go over your current gum health. What I found during your first visit after all and bunch assessments that we did, um, and what steps we can get together to improve it. I found that your gums are showing signs of advanced gum disease that is called periodontitis. I will show you here what I'm talking about. So, and this first imaging is show healthy teeth, healthy gums that no inflamed, no red, no. It looks pink. It looks really healthy. In your case, your gums are already red, angry, irritated. I can show you here that it's not pink anymore, it's red. This part is here red, and this yellow part is your bone. It's showing your bone. If you can see here, there's removed part, so there is distraction of bone. So it's affected this to support your teeth, and you can lose your teeth. We one of the full assessments that we did is called periodontal charting that we measure in between your gum and your teeth. So I explained to you in that day, like between 1 to 3, it seems like your gums are healthy. Over that number is something happened. In your case, you have a deep pockets that is 90 millimeters. So I can show you here your chart. So it's a bunch of numbers. It's a bunch of numbers here. It's a bunch of numbers here. So you can see that there is like some red numbers and black numbers. So the red is like something happened there, and the black is like you have a health in that part. So I can show you in here. In here there is numbers that nine that is something that is like really happen, or there is bone loss significant, and this stage is called stage 3 and grade C periodontitis. So you have a disease, you have to focus that you really have a disease, but I can help you. We can go work and this together. So it's a more serious that tends to progress quickly, and you can learn to lose the teeth over you don't treat this properly. So also I remember that you mentioned it about your dry mouth that is called serostomia. So and you're correcting a smoking habit, and the serostomia is contributing to how fast this condition is progressing. So maybe you have a question like how this disease is start. Like, so this condition start with a plaque. What is a plaque? A plaque is a layer that is filled full of bacteria filling up every day in your teeth. If you don't remove this with your proper toothbrush technique, it can lead to make really hard that is sticking in your teeth, and it's difficult for you in one point to remove it. This called in that part is called tartar of calculus, and this result to inflammation of your gums. If we don't stop this inflammation, you're gonna have bone loss. And eventually, you're gonna have tooth loss as well. In your case, I found that you have moderate to heavy plaque, mostly along the gum line between your teeth. That is here, and between the teeth that is here. And to remove the bacteria or tartar, we had to focus on the in your home care routine. And also I want to help you to remove it, the tartar, the calculus. You cannot remove it by yourself. So I want to show you another assessment that we did, that your full mouth serious x-ray. So I want to show you here why I look at it. So this all is your teeth. All your teeth are here. So we can see, if you see in this line here, this is your bone here. This is your bone here. So you go, it disappear here and go down. So if we cannot stop that part, you can lose these teeth. You see how look here? So it's supposed the bone, the level of the bone has to be in here, in this area here. So now it's go all down. So probably you feel that mobility in this tooth, and also here, look, probably you're gonna lose that part. So we're gonna like stop. Also think another thing that I want to mention is that probably you have a suspicious caries. So in your right upper, in your front teeth, on your right side, you have a little bit here. I don't know, you can like here, exactly here looks a little circle, like dark circle that is there. So probably you have a cavity there. So and here when I was doing your probing charting, there was bleeding everywhere, but there is a one part that you get a suppuration that is yellow, like the infection there. So I can see a little bit here that is under in your lower left side before you big molar. It's a little black here. So it's telling me in this part is here. It's telling me that some infection is happening. It's happening in that part. So after all the assessments, I would like to go over your treatment plan with you. So I'm gonna do something that is called deep cleaning. That is called scaling and root planning to remove all the bacteria, all the tartars or calculus below your gum line that you cannot see, that is going here. You cannot see, you cannot remove it anymore when you to brush technique. I need to use my instrument to remove it. And I will try to break it down and several visits. I'm planning to do in 3 visits. Probably it's gonna be only 2 visits, but I want to work first in your upper right quadrant, and then I'm gonna do the next visit. I'm gonna do the whole left side, and the last part is gonna be the right lower quadrant. This is gonna help to reduce the inflammation or to stop the disease. And so as well, I mentioned it. I'm gonna show you your home care plan. Your home care plan. So you have serostomia, that is dry mouth. I suggest you to buy this product, Biotin. Biotin is a gel. It's fresh gel. So you can put it on with your finger around all your gums, and the next day you're gonna feel more hydrated. And try to limit it your tobacco, your smoking. Use it as possible as you can. So if you wanted to quick, will have a huge positive impact on your oral health. Do this every night before to sleep. So it's gonna help you the next day to feel much fresh like. And also for you tooth pests, I will suggest something with fluoride. So this is the fluoride here. Also the same product, Biotin. So use this when you're toothbrush technique. So I will show you the toothbrush method that is called modified method. So it's called, you're gonna put it here and your gum here. So you're gonna go here when your toothbrush, and you like 45 degrees, just go down here like small, short strokes. You don't have to press too hard. You don't have to hurt. Just go to the line, make sure that is 45 degree, smaller strokes, 10 seconds, and just go down. And then you get another 2-3 teeth. Same thing. Be patient. So go down again. So for the lower teeth, you're gonna be exactly the same, just the bristles of the tooth has to look down, and you have to go to make a 45 degrees angle, and you go here, up, here, up, here, up. 10 seconds strokes, short strokes, up. For here, for the part of the tongue R here in this tooth, you have to put your toothbrush vertically, like here, and you go horizontal motions, here, up, here, here. Okay, doing this like twice a day, so you're gonna show really improve your you're gonna improve your inflammation. So if you have any question or you have any doubt, so just contact me. With your help, a consistent at home, we can manage this condition. Our goal is to reduce inflammation and to stop the disease to progress more further, and help to keep the teeth healthy and functional for as long as possible. Remember, I'm here to help you. I'm here to guide you through all this process, and I would like to check in your own progress at every visit. Thank you for your trust. Let's keep this working together, to better oral health. We are ready to take you take a really big step being here with me, and I'm excited to see your progress. Thank you so much, and I'm excited to see you next visit, okay? Bye-bye.